This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPHT or Odyssey.
Talk Radio 1210 WPHT, WPHT HD, WOGL HD3 Philadelphia. Now, Health Watch, featuring Dr. Molly Fantasia, the PhD doctor and founder of Innovative Medical Associates, with valuable information that could help you improve your quality of life. Now, Health Watch.
Good morning and welcome to a rare, beautiful Sunday.
At least in the last 3 or 4 weeks.
That's right.
Yeah.
That's right. It's good to have you with us here. Another edition of Health Watch every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. I'm your host, John DeMasi, with the one and only Dr. Molly Fantasia, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. And we will discuss the who, what, when, where, why, and how of Innovative Medical Associates, how they are different, and how they can help you and your family improve your overall quality of life. The number here in the studio, if you have a question for Dr. Molly or you want to run by her a medical challenge that you happen to have, 855-839-1210. That's 855-839-1210. And Dr. Molly, it's very simple. Innovative Medical Associates, what does it do?
What does it do, John? Same question. And, people say, aren't you tired of telling everybody? No, because it is a very difficult concept to get. We're a collaborative group of healthcare providers who work out of our facility, our primary care facility in Marlton. And what makes us different from the primary care facilities that most people have seen is our philosophy. And our philosophy is that, of course, we don't tell you get off of pharmaceuticals. If you need a pharmaceutical, the doctors write a prescription for it. It's simple, right? You go to the doctor, you get a prescription, you need a Z-Pak. That's the one I love to talk about because it's the one that people know about. You get in and you do a Z-Pak. But what we really love to do is we love to augment that Z-Pak with natural substances like vitamins, minerals, amino acids, anything that can help the Z-Pak do its job and maintain a smaller dose so that patients don't need repeated Z-Paks. That is a big problem today.
Yes,
you know that.
Yes, it is. One of the things that you do, and it's different from other places, is that you take the time to really study the patient.
We try.
Yes. And really you dig a little further than most.
In other words, just because you come in and say you have a sinus infection, I'd like to know why you believe you have a sinus infection. Tell me what the history is and maybe take a quick peek at the data and say, oh, well, you do have a sinus infection. And sure, have you been on Z-Paks before? Did your primary do this? And then, of course, the docs get in it and we'll order a Z-Pak.
And that's it.
That's it.
Yeah.
But you're also doing what? The hydration therapy that allows us to deliver things like high-dose vitamin C so that possibly we can shorten the course of your problem. And that's really the key. And reduce what? Reduce your need for certain pharmaceuticals and or reduce the dosing, which then what? Eliminates some side effects.
A lot of people come into you and they say, okay, Dr. Molly, I want to get started. But what do they know or how could they get an idea of how long they'll be there?
Well, that's an interesting thing because I'm finding a little bit more complex in this as we go on because people are coming to us, and particularly like I just had the group from out of state, as you know, I'm doing long distance. They came in and they thought they had a certain problem. In the end, it looks like they have several problems, not just one. So what you need to do is hone in. What I want to know is, what is it that you want me to improve in your quality of life? And it could be a number of things. And what we have to do is isolate that and say, okay, what's the most important thing we can do right now? And then the next, and then followed by the third. It can be quite complex, John. So that's why the free consult is so important, bringing in your records, etc.
And I would guess that people would want to know how long they're going to be there, but
Well,
you
it
just
could
can't-
be
you
it could
can't
be
really
as
tell.
short as 5 weeks, and it might be as long as 15. It really is going to depend on what brought you to us in the first place. And you know what else is interesting, John? I feel that people let their quality of life go down. And my goodness, I mean, it can go to a very low level of quality of life or no quality of life, and that's when they come in and see us.
Yes.
Wouldn't it be better to come in the beginning?
It sure would.
And the other thing I'd like to say is, how many times have I seen people in an acute situation? An acute situation, and you know how we are. You're in an acute situation. What am I going to do? I'm going to send you to the hospital. And I can't tell you how many of our wonderful listeners in the last 3 months have come into the office for the free consultation, said, I really need to see you. And when I see them, I know they're in deep trouble. Like the day you and I were sitting across from each other, and you said we're going to have a show, and we weren't. Okay, you were going to the hospital.
That's right.
So the point is that I think people just are afraid of the traditional model, and therefore we put off doing things that intuitively know we should be.
Best to kind of see you and not think about when you're going to end it.
Exactly.
Just
Let's go in and start it. And
yes.
you know what else, John? Let's start it early in your healing journey so that we don't have these problems that people come in. You know, it's the same thing, John. You know, I see a lot of cancer patients, right? And how the frustration for me is that they come in when they're in stage 4. Heck, do what our wonderful patients who've been with me for like the last 10 years or so come in their early stages, right? Yes, do the conventional. Finish your conventional if you want to, but get right in at the beginning of the diagnosis. Isn't that better?
Of course it is.
And you know how the outcome changes? Exponentially.
What seems to work best as far as your system, your hydration therapies, and conditions? Like, what conditions work best?
I can tell you I've seen so many conditions the last few years. I mean, Lyme disease has been off the charts. Environmental problems have been off the charts. People who've been over-medicated with certain medications that affect brain function, off the charts. Cancer patients who've exhausted their traditional meds and come in as a last minute. And by the way, even in that point, we give them some quality of life. But wouldn't I like to give them a longer quality of life? You bet.
Absolutely.
You bet.
Are you able to get most patients off of their prescription meds?
We definitely try to do that, or reduce the amount they're taking. That is sometimes more importantly. And the doctors, of course, want to make sure that we want to keep us safe. First, do no harm. And that's also a challenge, because when you're on medication so long, it is soaked into the tissue, etc. So getting them off of some medications is very difficult. And that has to be done very, very carefully, along with the registered nurses, my techs, and the good doctor.
We have talked a lot about this, and I know it's a really a stickler for you. All these medications.
The new ones in particular.
New ones. Now there's new ones coming out for
that
this and
that are new on the new. Right?
New on the new.
Yeah.
And they have these disclaimers.
Exactly.
That are like, they do a commercial, they do 15 seconds of the commercial and 15 seconds of a disclaimer.
Right.
And talk about that and why you want to get people off.
Well,
the prescription.
here's the thing. The thing is, look, when you need medication, you need medication. The idea is not to over-medicate a patient. I think most physicians really don't want to over-medicate, but there's a frustration level about how much they can do in the period of time that they have. So for our patients, we look at that and say, okay, what kind of natural substances can augment and have work on the same mechanism? Why, people say to me, well, it doesn't work. Well, it does. If you can reach a therapeutic level,
right,
that can help you reduce some of the meds. And again, that's going to be individualized. You can't say that, you can't make a broad brush of that and say it works for everyone. I mean, I have patients who are on some cholesterol meds, but not as dire as they could be after we do a round of chelation. So they're able then to tolerate the med. So it really depends on what we're trying to accomplish, John.
Okay, we are coming up on our first break of the morning. The show is Health Watch. It is here every Sunday, 8 till 9, here on Talk Radio 1210 WPHT. Dr. Molly Fantasia is here, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, Marlton, New Jersey. 855-839-1210 is the number here in the studio. If you have a question, and you know what we always say, if you call early, we can pretty much guarantee we'll get you in, and the Dr. Molly will try to help you. 855-839-1210 is the number. I'm your host, John DeMasi. Dr. Molly and I return after these words. As always, operators standing by at Innovative Medical Associates, and their number is 856-489-0505. Notice I said that slowly. You can write it down. 856-489-0505. Innovative Medical Associates, Marlton, New Jersey. If you call them right now, you can schedule that initial consultation, which is complimentary with Dr. Molly, and that's really where you can find out what your issues are and your situation and how potentially Dr. Molly can help you. And, of course, the website, innovativemedicalassociates.com. innovativemedicalassociates.com is the website. Our show is Health Watch every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. If you want to talk to Dr. Molly right now, 855-839-1210, 855-839-1210. One of the things I like about doing this show, Dr. Molly, is that I always learn something every show. And you're going to tell us about the CMV virus.
Right, the CMV virus.
And I've never heard of that.
Well, let me tell you about this. It's very interesting. First of all, I should talk about my patient. The reason why this came up is because I have patients who've come in from Indiana. And this patient is telling me all of her symptoms, and she has her records with her, and I'm looking at this, and I'm seeing that she's on a tremendous amount of medication for antidepressant and anti-anxiety and all kinds of neuro kinds of things, right? All kinds of psychiatric and neuro drugs. So I said, well, can I see some of your blood work and everything? I asked her to bring up a complete chart. Well, it was just a routine blood work. She's 50 years old, perimenopausal. All of that was written in the chart. And I thought to myself, well, there's really no testing in there that may account for some of the symptomatology that she's having, the brain fog, the anxiety, the depression, all of these things, not even a hormone panel. And I'm thinking, oh, that can't be right. So obviously we jump on it and we want to call and get other records if there are none. And to our surprise, we had them all. So we knew that what has happened here is fundamentally the patient has been not really looked at from a holistic point of view, and as a result, this virus, as well as 2 or 3 other viruses that she has, was overlooked, John.
So what this patient then is in limbo because they're not really addressing it.
She's not just in limbo, she's in deep trouble because on top of this, she was given a short-acting anti-anxiety that is very difficult to detox from. Very difficult. And it's something that our docs and I were talking about, and they said, boy, are you on it, Dr. Molly. We first have to get her off of that anti-anxiety, and we have to do it very carefully. We, of course, are not going to touch the antidepressant, and indeed, she may need another form of the anti-anxiety, but something that would be a little longer acting. These are short acting. This is a short acting and very difficult. You really get a thing where you need more and more of them to do the job. So you can imagine that's a dependency that we're looking at now on top of her condition. So here's the thing. This virus, it affects between 60 and 90% of adults have this virus. And a result of the chronic infection is a depletion of certain native immune cells. Back to our immune system, right? Like all of her symptomatology can be twofold. It can be a result of possibly the anti-anxiety, but there's a good chance that the initial thing was a result of these viruses. And her immune system, unfortunately, was compromised. And what happened is she lost the native immune system, or the young ones, and accumulated excess of the memory cells, or the senile memory cells, as the people like to talk about. So what happens then is we're out of homeostasis. Right? We're not in the middle, like I talk about Goldilocks. We may have too many of the senile cells that have the memory of certain viruses. And what happens is the younger cells that are depleted become vulnerable to the disease that we fought off in our youth.
Okay, we're going to pick that up in a moment, but we have a call.
Oh, sorry, John.
No, that's okay. You don't be sorry. Joe in Germantown. Joe, good morning. You're
Hi,
on Health
Joe.
Watch with Dr. Molly.
Good morning, Dr. Molly. Good morning,
Hey,
Jack.
Joe, one of our favorite people, guy who understands. Yeah, how
Dr.
you
Molly,
doing?
I'm like, John, I'm sorry. I didn't mean to interrupt you, Dr. Molly.
That's all right. I'm glad
some
you did,
information.
Joe.
But, thanks, Dr. Molly. I just want to say earlier, I learned so much, Dr. Molly, and I don't just say this just to be just saying. I mean it from my heart, Dr. Molly. You're a testament to your work. Anytime you got people coming from as far away as Indiana to come see you, that's a testimony to the great work you do. Because, like I said, Dr. Molly, the human body works so unique and stuff like that, and I have been learning over the last, year or so, Dr. Molly and John, there's so many people in this country suffer from vitamin D deficiency,
Ooh,
you know what I mean, which is alarming. And as a matter of fact, my former place of business, Cooper Health System, they did a study recently over the last couple of years, I think, with vitamin D and stuff, because like I say, all vitamin D is not necessarily created equal and everything. So the work you do, Dr. Molly, it's a testament. That's why I love you, Dr. Molly, you and John, because y'all put out good information, because what I always try to do, and I close with this, I try to encourage all my friends and family, people that I care about, to eat healthy. You know what I mean? If you drink alcohol, try to limit and do it in moderation. I encourage them, don't smoke and everything like that, and try to eat a healthy diet, exercise, listen to music, take walks, runs and stuff, and so you can de-stress your life, go out and lay on the beach and down the shore, whatever. Do things to keep your life, permanent, and so you don't be all stressed out and stuff. And like I say, eating a healthy diet is important. And like I said, Dr. Molly, what you do every Sunday, you and John and stuff, y'all, it's beneficial because, like I said, anytime people come from Indiana to see you, they just go to show you, Dr. Molly, you're on the right track and you're doing the right thing. Okay?
Well, you know what, Joe? I want to ask you this. You know how
Sure.
I believe. I believe it's all about the good Lord, too.
Yes, indeed.
He's the
Oh,
doctor.
yes.
He's the doctor.
Yes.
Did he not give us all these wonderful, wonderful nutrients that we can get in this world, and most of us just ignore them, right? Bad
That is so
food,
true.
bad drink,
Mhm.
right? But
Yes.
the good Lord is our big physician, and I tell you, every
He
day
is.
I know that he's working in our clinic, and I know, and I tell my patients, listen, my doctors and myself, we may be instruments of that, but honestly, it's him. And
He's
I
the big
believe that with
physician.
all, yes, ma'am. Sir, I'm going to tell you, you're one of the smartest callers we get, and I enjoy it because John and I talk about how you managed to get yourself through COVID. So may God bless you.
Thanks,
and
Dr.
yours.
Molly. It means
Thank
a lot
you.
coming from you.
Joe,
Thanks so much.
thank
You have a
Thanks for
blessed
the
day.
call.
Thank you.
Thanks
for the
call,
That's
Joe.
a great call because
Yes.
he's a testament to really the kind of approach that we take.
Yes.
So
What I wanted to talk to you about,
Sure.
question. You mentioned senile memory cells.
yeah, senile memory cells.
Does that mean senile as in what we
No,
know?
no.
Okay.
It means they're just older cells that have a memory, meaning an old memory. And that old memory is used to fight off some viruses. But what happens is they respond to the original antigen. So it's a little complex. But what I'm going to say again, to keep it simple, John, like we always do, you need to tune up your immune system. So we need good, healthy, young immune cells that then go after things like this virus that is in our body and that doesn't go away. It's under control, right? When we're young, we're not affected by this virus. But as we get a little older and changes in our biochemistry, like for this woman that I'm talking about, she's 50 years old. She's perimenopausal. She didn't even have any hormone studies done. So, hormones have an effect on our immune system. But can you imagine if during this period of time you're taking all these drugs, the doctor thinks it's in your head, so therefore he gives you a short-acting anti-anxiety that we know from the scientific point of view is very, very addictive. How are we going to get her better if we don't change a whole lot of the immune system and we don't address this CMV virus? And we then look at some of the other viruses that she has and see what can we do for this woman to get her back to homeostasis. Therein lies the answer. There are so many things sometimes in conventional medicine that gets overlooked because the standard of care doesn't always live up to what we believe in the kind of practice that we do. The overlooked factors are just as important as what the patient is coming in to see you for. That's why you've got to look at the charts. That's why you got to have some specialized testings, right? That's why you need proprietary protocols. That's why you don't go to a spa for the kinds of stuff that we do at
another complex case
right.
that you are presented with.
Right. And
this is a mess, really.
This is a mess. So here's patients that thought they were coming up for 10 days. They're going to end up coming up for more than 10 days. And I had the discussion with them, and absolutely they know that. They have to go back for one of their kids' graduations, but they're coming back to me the following Monday. And I said, listen, if in any part of this, after what we've gone through the past 10 days, you go back on the addictive drug, you're going to have to start all over again because we won't be able to tune up the immune system while worrying on that. So can you imagine the complexity of this?
Boy, this is really
and you
one.
Don't want to put your patient in harm's way. Right? You
yes.
don't want to do that. So you can imagine my doctors were on high alert, and my staff was on high alert, and it took a lot from our perspective to take care of this gal.
We are at the halfway point of the show already. Boy, time flies when you're having fun. It's Health Watch every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. Dr. Molly Fantasia is here, the PhD doctor, the executive director, and the founder of Innovative Medical Associates located in Marlton, New Jersey. Again, the number here in the studio, 855-839-1210. We have plenty of time to take your call, so call now if you'd like. 855-839-1210 is the number. I'm your host, John DeMasi, with Dr. Molly Fantasia. We both return with more Health Watch after these words. Operators are standing by right now at Innovative Medical Associates, and they're ready to take your call, especially if you want to book that initial consultation with Dr. Molly. 856-489-0505 is the number. Innovative Medical Associates, Marlton, New Jersey. 856-489-0505. And the website, innovativemedicalassociates.com. innovativemedicalassociates.com. A lot of good information on that as well. So check it out, innovativemedicalassociates.com. The show is Health Watch every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. And the number here in the studio, if you have a question or a medical challenge you want to run by Dr. Molly, 855-839-1210 is the number right here in the studio, 855-839-1210. Continuing on this discussion,
sure.
Dr. Molly.
Sure.
What is, and you can explain this, what is biofilm?
Well, biofilm actually is the jelly-like substance formed around a cluster of the pathogens. So in this case, the case that we were talking about before the break, it's the viruses. So they all come together and they're causing havoc in the immune system and the patient's feeling terrible. So one of the things that we have to do is we actually have to strip that biofilm. And there is a way to do that. I have a proprietary blend of nutraceuticals that go after the biofilm and allow us to do this, and then actually use the detox also during that period of time. So again, what we're looking at is the overlooked factors in the standard of care. Starting from the initial visit, I need to make sure that we don't have an incomplete diagnosis for the patient, right? I need to discuss that with the doctors and say, look, patient is presenting this way and has been treated this way by the conventionalist, but not getting relief, right? So It may be an incomplete diagnosis. How do we handle that? Well, I'm a big believer coming out of the laboratory, we need possibly more detailed, specialized testing. That's not to say I want to spend patients' money on testing that isn't covered, but actually we have good CLIA certified laboratories. It's just a question of picking out the testing that might be necessary to help us not go down a rabbit hole and look at the wrong thing, but really help a patient come back to homeostasis. We might then have to look at the detoxification. We have to look at the proprietary hydration treatment protocols that's going to fit this case, especially when we get back laboratory results that show that she's being treated for her anxiety. That's the symptom, right? She's being treated for the symptom, but the cause may be this CMV virus and the other viruses, the combination of viruses in her system. And so we have to look at that, and then we may have to do the detox. We have to look at the proprietary blends. And then finally, what do we have to do for this patient? We have to reestablish her immunity, her immune system. And you know what is a good thing to help us do that, John?
Vitamin C.
Right, but
That's
what
right.
extract of vitamin C for her in this case? So you can see that in doing this case, I'm thinking on all of those levels, and my physicians are thinking on all of those levels, and together we are putting together the treatment protocol for this young lady.
I am really curious to know how come that you've gone through all of this and somebody comes to you and says, well, my doctor said it's in my head.
Yeah, I know.
I just don't
I see
understand
that so often in women. I actually see it in a lot of guys too, but it's really, for guys, they always say it's low T. It's always low T, right? Hey, but for women, it's always perimenopause. It's always bad hormones. Well, hormones have an effect on our immune system. Don't ever forget it, guys and gals. So again, I want to see all of that before we start saying, really, it's in your head and there's nothing wrong with you, right? Because I'm telling you, more than not, there is something wrong with you. If you're feeling it and your gut tells you, guess what? Jump on it, folks.
So you test more than the average.
I would say that is absolutely true. Because again, but it depends. Now, if somebody comes to me with a complete chart and you see they've run all these down, well, that's a different story. But I'm going to tell you, in more cases than not, there are overlooked factors that contribute to people's problems. And therein lies the rub. I see that a lot with mold, etc., with the environmental medicine. A lot. People just poo-poo it, and then you send out for specialized mold testing, and guess what? They turn out to be positive on an obscure mold. So they really were suffering from mold toxicity, even though maybe it wasn't in the traditional panel run in New Jersey. Maybe it's a mold that's usually found out in Oklahoma. But guess what? You also have to get a detailed history from the patient. So there you go. I mean, it's there, John.
So now that you've found out what's wrong, pretty much.
Yeah.
What's the prognosis, and how long does this have to go on?
Well, you have to understand that it took us 2 weeks to just get her off, knock the receptors clear of the anti-anxiety. That has to come first, because you can't get anything done. I can't go after the viruses. I can do some work on the immune system, but can you imagine the havoc she's been in, just blocking all these receptors in your brain? Come on. And these viruses, by the way, do cross the blood-brain barrier. They found this on autopsy.
Boy, this is really
so this is going to be
case.
It is, and it's a fun case also. I mean, my docs are in it. We're having some fun with it, which I shouldn't say we're having fun with at our patient's expense. I'd like to say that we're doing the archaeology, and we're really going to try our best to reestablish her immune system, but it's going to take a 4-week course.
855-839-1210 again is our number here in the studio, and if you have a question for Dr. Molly, feel free. 855-839-1210. The young girl who had the water on the brain. Remember that case?
Sure. Do I remember it?
Yeah,
of course.
She's
coming in almost every week. She took a 1-week break, and I saw her Friday. I saw her Friday. And my goodness, she is completely changed between doing her traditional, and here, this is a good case about good traditional medicine, good standard of care medicine, just delivered in a different way. The oncologist who I use as a consulting oncologist to our practice is her oncologist. So he's been giving her a form of chemotherapy for the breast cancer, and because I was astute enough to know that she didn't have a particular genetic study on this, we alerted the oncologist because she had her initial treatment in Mexico. It took a while for us to get the slides back. They were sent out for the genetic testing, so he was able to refine the traditional chemo in a way that hasn't allowed her to go completely immune stripped. And then I'm doing the supportive care back at our facilities. This young girl looks like a different young girl. I am telling you, it was really heart-lifting for me because we're bringing her immune system back to life while she's being treated somewhat conventionally, just in a little different way. And there are people out there that do this kind of treatment, and we then become the backup for it.
This is a case, and I know you probably feel good about this, but your oncologist said that whatever you're doing, keep doing it.
Oh, yeah. He said, listen, I know, he knows. And again, it's interesting because we're using some peptides for this young lady, and they're smaller proteins, and I don't want to go down the road of peptide therapy today to talk about it, but we are using a particular peptide for her, along with using certain things that can enhance the chemotherapy and not cause the anti-inflammatory problem that he's actually, chemotherapy causes inflammation. So I don't want to ruin that. So I have to be really careful about what we use and when we use it. But it's working well.
From this point forward, does she continue to come in?
Oh, yeah, she's coming in once a week. Absolutely. She comes in once a week to us, once every 2 weeks for her traditional treatment with the oncologist.
And so she's pretty much
she's
on
doing
the road
well.
to recovery.
Well, I can tell you one thing. All of her markers have gone down 70%. 70%.
Wow.
And
that's
family
tremendous.
and I are thankful to the good Lord and to our consulting oncologist as well.
We could talk forever about these kinds of cases.
No question.
Okay, we are coming up on our final break of the morning, which means you still have time to get in here with a question or two. Or maybe you want to run by the medical challenge that you're having with Dr. Molly. 855-839-1210 is the number. 855-839-1210. The show is Health Watch every Sunday, 8 till 9, here on Talk Radio 1210, WPHT. Dr. Molly Fantasia is here, the PhD doctor, the executive director, and the founder of Innovative Medical Associates. I'm your host, John DeMasi. We both return after these words. We are back here on Health Watch, and operators are standing by at Innovative Medical Associates. And we remind you that they'll be there well after we leave you at 9 o'clock this morning. They'll be there at 9 o'clock, at 10 o'clock. They don't go home. 856-489-0505 is the number. 856-489-0505. That's the number for Innovative Medical Associates, Marlton, New Jersey. And when you call, you want to book that initial consultation with Dr. Molly. And as I said many times, that's where you really find out the who, what, when, where, and why of Innovative Medical and how it can help you improve your overall quality of life. So again, that number, 856-489-0505, and the website, innovativemedicalassociates.com. Innovativemedicalassociates.com is the website. The show is Health Watch every Sunday, 8 till 9. Here on Talk Radio 1210 WPHT. If you want to call right now, we have some time left on the show. 855-839-1210 is the number. We have time to get one or two more calls in here quickly. 855-839-1210. We're going to talk about rheumatoid arthritis
arthritic condition,
joint
pains. And this is an interesting case. This patient is pretty bad. She's a woman in her 60s. So she comes in, and you can clearly see the joint damage that she has. I mean, so of course, we review the chart. We're looking at the chart, and I'm talking to her, and it turns out that she did have Lyme disease, probably 5 years ago or so, 5 years. And her symptoms, these symptoms of these rheumatoid things, although they occurred maybe within 2 years of the Lyme disease, have gotten significantly worse. So, of course, we did a Lyme test to see that she had the antibodies for Lyme, and indeed she did. So I asked how was that treated, and the doctor put her on the doxycycline orally for, I think, 3 days. And at the time, that probably was the standard of care. But here we go. This is what I would consider an overlooked factor. In other words, someone who has the full Monty, where she actually had the bullseye rash, she had the headache, the fever, the exhaustion, the muscle pain. She might have needed an IV antibiotic, but unfortunately, it wasn't given. And now what she has is the post-Lyme viruses and bacteria that is contributing to all of the swelling of the joints, and again, having the headache, having the exhaustion, and the brain fog. So this is the kind of thing that is very common. And what I'm trying to say is, yes, we can give you the anti-inflammatories that can give you the relief on the joint pain. But really, the underlying thing is we've got to get your immune system back, right, to help fight the viruses that are still active from the post-Lyme. That may include a detox.
Back to the question. The doctor gave her 3 days. Should he have given her more?
No, that's probably that's one of those things that is common. I mean, it is a standard of care, I believe, and I'm talking about at that time.
Yeah, okay. We'll pick that up after we take this call. Frank in the Northeast.
Oh, hi, Frank.
Good morning.
How are you?
Welcome to Health Watch, Dr. Molly.
Hey, Frank.
Good morning, my favorite duo.
How you doing?
I was just going to listen today. That's all I was going to do, Dr. Molly. But you said something that ruffled my feathers, okay?
Okay.
You know what it was? When you mentioned about doctors tell people it's just in your head. Oh,
yes.
my God, that drove me nuts.
But Frank, I think somebody told you that once. Right.
That's what I'm calling in. When I was first diagnosed with my eyes in 2000, I was not symptomatic, so it was no big deal. It was frustrating because I couldn't drive no more legally.
Right.
It was about 10 years later, I became symptomatic, and I'm seeing different doctors, different specialists, and they couldn't figure it out. And they patted me on the shoulder and said, it's just in your head. You want something to be there so bad you imagine it. I'm like, no, I'm not imagining that I'm not seeing things no more, you know? It was frustrating. I heard that many, many times from so-called specialists. And my word to doctors out there, if you don't know, you don't know. Look a patient in the eye and say, I did every test. I'm stumped. I don't know what's causing this problem. Just be honest with us.
I agree with that. You know that. I agree with that. Here's
I
the
know.
thing.
I love you, Dr. Molly.
Obviously, something went haywire there, and somehow it was overlooked all along. And that's my whole point about this, because if we continue to tell everybody it's all in their heads, and you know what they want to put you on, right? You know the drug they want to put you on, the anti-anxiety that's short-acting that people get highly, highly dependent on. Guess what happens? Now you got a multitude of other problems, right? What comes first, the chicken
Dr.
or the
Molly,
egg?
in my layman's opinion, I think it's because of years of poor nutrition, and I was a big drinker for a long time.
Sure.
If I had the genetic mutation, so what? It doesn't mean you have to have it.
That's right. That's
Just
right.
one more thing, Dr. Molly, please. I'm Joe from Germantown. I call him Mayor Joe from G-Town, okay?
Yes.
I never knew his COVID story. He's great. I love listening to him. I wish he would run for mayor.
He's the best. Isn't he the best?
Seriously. Dr. Molly, do you think my problem is nutrition-related from deficits of poor nutrition?
Well, you know what? I think you said something that was really true and heads home for Dr. Molly because, I don't know if you know, I lost my sister to over-drinking. And she went out of this world even before collecting social. By the way, she was a nurse also, Frank. The job itself gives you guys a lot of stress, right? Come on. You were...
Plus being a cop, too.
Right. So you had a double whammy. And here's the thing. The drinking can contribute to a lot of organ damage and then poor nutrition, immune problems. God only knows the factors. All I can say is I sympathize, but I also have a great deal of admiration for you because you knew what the underlying issues were and you stopped it and you got it getting on the road to health. So all I can say, Frank, is that I wish more people were like you. And maybe we wouldn't have some of these issues. God bless you in your journey.
Thanks, Dr. Molly and John.
Frank,
and I'll listen to you next week. Thank you.
Thanks
Bye-bye.
for the call. Thanks for the call, Frank. We appreciate it. 855-839-1210 if you want to get in here real quick. But we want to get back to that story of rheumatoid.
Well, it's a rheumatoid-like problem. So here's the thing. In her case, now that I know this, and she didn't equate the post-Lyme to her problem. She just said, the doctors told me I have arthritis. This is all we can do. You can go on the biologics. Well, yeah, you might have to go on the biologics. I certainly can't cure arthritic conditions. I can't always cure this. But I can give her a little bit of a quality of life by utilizing some of our natural anti-inflammatories, like the curcumin, like the boswellia, and many other things. But the idea is I also have to look at what else is going on for her to bring that immune system back to homeostasis, meaning just right. And maybe we can give her a little more longer-term relief than just the short-term relief. So, this is another complex case, John.
Back to what I said to you earlier in the show, is that you take the time to really delve into a situation. And I think a lot of the cases that they come to you because maybe doctors just said, "Oh, well, it's that, and it's in your head," or whatever.
Well, Frank's a good example of that. You think you lose there's hysterical blindness. Of course there is. But you know how rare that is? Come on, give me a break. Not everything is in somebody's head. And, I had a mentor who taught me, he said, Molly, always remember that even crazy people get sick. Don't forget it, my friend.
Can we have time, Jim, to take this call? Shirley in Lindenwold. We'll take her. You got about a minute, Shirley.
Hi, Shirley.
Okay. Good morning, John, Dr. Molly. Dr. Molly, I'm having problems with calcification. I just had calcification tendonitis last week. And I went and I had acupuncture, and it feels great.
Good.
But I get cramps like on each side of my neck, and my chiropractor gave me this here electrical thing to put on to relax the muscles.
Very cool. Very cool. Good. That's the right approach. You're doing well. And you know what? Here's the thing. I think what we can do also is you do some form of chelation and help you remove some calcification.
Yes. Okay? Shirley, call Dr. Molly in the office because she can delve into this a little further with you in the privacy of the office. We're running out of time, unfortunately.
God bless you, Shirley.
Thank you for the call. And with that, we put the wraps on another edition of Health Watch. Don't forget, Dr. Molly is available during the week at 856-489-0505, 856-489-0505. And the website, check it out, innovativemedicalassociates.com. innovativemedicalassociates.com. And don't forget, if you missed any of today's show, we replay it for you this afternoon at 4 right here on Talk Radio 1210 WPHT. For Dr. Molly and everyone at Innovative Medical Associates, the lovely Linda, our nursing staff Barbara, Catherine, Lana, and Donna, and of course Joanne, delightful Dee, fabulous Fran, and our nursing assistants, Karen, Kathy, and Sandra. I'm your host, John DeMasi. Thanks you for listening. We will talk to you next Sunday, 8 o'clock, right here on Talk Radio 1210 WPHT. You take care.
This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPHT or Odyssey.